for today's virtual media briefing about COVID-19 in London and Middlesex County. We are glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. A welcome to members of the media in attendance this afternoon, and for those who are returning and have been with us before, and for those who may be new, just a reminder that when you do have questions, click on the text bubble with the question mark here on Microsoft Teams. And if you could, when you submit your question, indicate your name as well as your media outlet and who your question is for. Finally, a welcome to those joining us on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio 980 CFPL, and those who are joining us on the CTV London website. Let's get to the opening remarks right away, and we'll start with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. So we've had back-to-back days now of case counts in the mid-30s. While it's not necessarily time to press the panic button, it certainly causes concern. At the same time, I take some measure of comfort knowing our vaccination rates continue to climb, with more people, and especially younger people, rolling up their sleeves on a daily basis. When I look at the overall numbers as of just a couple of days ago, London Middlesex had pulled ahead of the provincial average for first shots administered to the 12 and older population. We're at just under 85%, 84.7% to be exact. And we're now at the provincial average on second shots at 78.4. Let me also thank those who remain active, involved in our vaccination efforts through any number of ways. And that includes staffing our mobile clinics at White Oaks Mall, which opened earlier this week. We saw great turnouts at a similar clinic at Masonville Place earlier this month. And we're hoping that success to continue, one vaccination at a time. Beyond that, and unrelated to the pandemic, I'd like to give a strong acknowledgement and shout out to those from Fanshawe and Western, in particular for speaking up and taking a stand against gender-based violence. I know the London Police Service continues to actively investigate recent allegations. It's absolutely critical we allow that investigation to proceed. Regardless of the outcome, however, we know that gender-based violence exists. And we also know, or at least we should know, that every single one of us has a role to play in its eradication. The City of London, for example, is an active participant in Safe Cities London, the United Nations initiative which is aimed at addressing sexual violence that occurs in public spaces. We're also fortunate in London to have such a range of compassionate staff and volunteers at a number of support organizations. That includes ANOVA, the London Abused Women's Centre, and at LOSA, along with case managers both at Fanshawe and Western. Ultimately, however, as I mentioned, we all have a role to play. Everyone can make a difference, and everyone can look out and stand up for one another. In part, it's how we act, how we behave, but it's also what we say and sometimes what we don't. I noticed just very recently in media that there are signs that are being put on Western's windows and doors, and it says, "See something, do something." Again, it's been a traumatic week for too many. Never mind, as a father or as a husband or brother, as a human being, my heart breaks for those who have suffered. Aside from supporting those who have been subjected to gender-based violence, we owe it to survivors to ensure it doesn't happen again. Over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. As usual, you've hit some very important points. I appreciate you identifying this region pulling ahead of the provincial average in terms of vaccination rates. If you look at how the province calculates those rates, we're actually even further ahead at 87% first doses and 80% second doses just reached this week. And absolutely appropriate, I believe, to bring the issues happening in association with gender-based violence around students and young people in our community into the conversation around COVID. We are seeing a lot of people reacting in ways that have caused harm related to the pandemic, whether it's the stress of lockdown or whatever the case. Certainly, there are no excuses here. And I think there was a firsthand account shared on social media this morning of a sophomore supervisor who had been part of orientation week activities. Very disturbing to hear firsthand from her what she witnessed. On the COVID front, we do have some important developments. The federal government has now indicated, and Ontario is aligned, that in spite of some vaccines that are used overseas being approved by the World Health Organization, they won't be considered adequate in terms of the vaccine certificate system that Ontario is implementing. The two vaccines that come out of China are the Sinopharm and the Sinovac vaccine. At this point, Health Canada and the Ontario government are not considering those doses of 2 doses of Sinopharm Sinovac to be adequate to be considered immune under the vaccine certificate system. That will mean that people who have had those vaccines and have not had an additional dose of either AstraZeneca or one of the mRNA vaccines, Pfizer or Moderna, will need a 3rd dose of one of those vaccines. We've had a number of people come forward with this question, and up until now, the provincial federal government have considered, the WHO approved vaccines to be adequate. At this point, that is changing. And so, a number of people have actually come through our clinic, lots of students or international travelers saying they've had 2 doses of Sinopharm or Sinovac and being told you don't need an additional dose. And that advice is changing now. So those folks do need a 3rd dose of ideally one of the mRNA vaccines that are available in any of our clinics. We have had a bit of an issue arise with a religious exemption form that the health unit had been using for staff. Because it was publicly available, we made it available for businesses in case they wanted to use it. It's actually been abused. It's been used in other jurisdictions as a form that should justify religious exemption to vaccination. That's not the purpose of the form. It was really an internal form to flag for our HR team that there was a need to have a conversation with the individual. So even within the health unit, filling out the form wasn't an automatic religious exemption. What it did was trigger a conversation so that can be worked through between the individual and the organization. Others have used it elsewhere to say, look, I've got this completed form, therefore I'm exempt from vaccine passports or certificates. That's not the intention, and we've taken that form off the website in order to clarify that. A bit of good news, we had tremendous showing yesterday at the White Oaks Mobile Clinic, and 266 vaccines given. We almost ran out of vaccine yesterday. There was just 1 vial left with 6 doses in it at the end of that day yesterday with the White Oaks Clinic at 7 p.m. when that clinic was winding down. So tremendous turnout by the White Oaks community and folks using the White Oaks Mall. Once again, thanks so much to White Oaks Mall for partnering with the health unit to offer that clinic. And we've sent them more doses than previous days today, and hope to see that demand continue, and we'll continue to be ready. Big thanks to everyone who continues to roll up their sleeve. In order to highlight for you the shift towards mobile vaccine, I'm going to share our daily update bulletin that we have shared on this call a number of times before. Is that coming through, Dan?
Yes, it is, Dr. Mackie. We can see it.
Great. So this is the dashboard of vaccines that have come through the health unit or the partners working directly with the health unit, such as London Health Science Centre at the Agriplex or Middlesex-London Paramedic Services. And you can see that cumulative doses, the difference between this and what is reported on our website is essentially pharmacy doses. So there are well over 100,000 doses that have been administered in pharmacies, and big kudos to the pharmacies there. Almost all the rest of the vaccines are through this dashboard. The total doses administered yesterday were 766. The Mount Bridges Clinic, Agriplex, is closed Tuesdays and Wednesdays. Mount Bridges is open on those days. The Mount Bridges Clinic saw just 91 people attend the clinic yesterday. Our mobile teams, and we had, I believe, 3 in the field, had 532 doses administered. So the large bulk of those 766 that were administered yesterday, including, as I mentioned, 266 at White Oaks Mall, 143 other community partner vaccinations. That would include primary care and Middlesex-London paramedic services. So you can see that mobile is what's happening right now. That is really where people are attending to get the bulk of vaccines these days. Dan, I will pause there. Look forward to any questions.
Thank you very much, Dr. Mackie. And we do have quite a few questions, so let's get to those right away. And in looking through the questions, I noticed that there's some breaking news that's been happening in the last couple of hours around Health Canada's decision to shift from the company names for vaccines to the trade names. So, Dr. Mackie, there are a couple of questions about that we'll be getting to shortly. All right, the first question this afternoon comes from Jane Sims at the London Free Press. Dr. Mackie, it's been 2 weeks since the health unit advised local businesses that they should have their own double vaccination policies. Since that announcement, how many businesses have reached out to the health unit for guidance? Do you expect there will be widespread policies to match the province's vaccine certification program starting next week?
Jane, a number of businesses have reached out. I don't have a count for you at the moment. One of the main routes is that we will be co-hosting a webinar with the London Chamber of Commerce as of next week. And so that's where I think we'll have a lot of the engagement with businesses. And we can certainly update you after that around the attendance there.
Thank you very much. Let's go to the next question, and it's a follow-up from Jane Sims. Dr. Mackie, here we go. Health Canada announced it will be using the new trade names for the Pfizer, Moderna, and AstraZeneca vaccines, now to be called, and I practiced this a little bit, Comirnaty, Spikevax, and Vaxzevria. Will the health unit be using those names as well?
You know, I appreciate the question, Jane. I don't think we've put a lot of thought into that. We want to use terms that people will recognize and understand. So certainly we'll look at that. But the name of the vaccine is not the primary concern for us. It's really the safety and effectiveness. And we have 2 excellent mRNA vaccines and a strong AstraZeneca vaccine as well.
Dr. Mackie, I am going to skip ahead on a couple of questions just to take care of all of the trade name questions at the same time. Jacqueline LaBelle at Global News Radio 980 CFPL has a related question. Dr. Mackie, is the health unit worried at all about any potential confusion caused by these new vaccine names? If so, will the health unit do anything to help combat that confusion?
Yeah, I mean, this is really a branding and marketing issue. It's something that the vaccine manufacturers feel is important. From my perspective, it's not really where we put a lot of our attention, but certainly if anybody has questions or uncertainty, we'll use whatever name makes sense and whatever name they understand.
Thank you, Dr. Mackie. And if you'll permit me, there is one more here. From Christy Lee Varley, who I believe is joining us for the first time from CTV London today. So we've talked about the trade names. Dr. Mackie, do you think this move was necessary on the part of the Public Health Agency of Canada? And do you think it will be confusing to people who are perhaps considering the vaccine or when people go for their booster shot?
Again, appreciate the question. We're not the experts on branding or labeling. We will continue to communicate however people are best can understand.
All right, thank you very much. I think that does take care of those questions. So let's move on to the next one. It comes from Jennifer Beeman at the London Free Press. Jennifer asked, Dr. Mackie, should Ontario take any lessons from Alberta, which has had to change course of action and immediately implement strict restrictions?
Well, I think Ontario has very much taken lessons from Alberta. A month or so ago, you were hearing talk about reopening fully, moving past step 3. Many were asking, shouldn't we be more like Ontario? Shouldn't Ontario be more like Alberta? I think the case counts and decimation of the hospital system in Alberta have answered that question. And it's clear that the provincial government has taken many lessons. And, we don't hear any discussion about further reopening at this point, which clearly is the right thing in terms of controlling COVID.
And a follow-up question from Jennifer Beeman. Dr. Mackie, should more moderate restrictions be put in place now to help mitigate the fourth wave instead of more harsh restrictions later on?
The important step that is happening right now is around mandatory vaccination policy. That will create a much higher degree of safety in many indoor environments where we know virus can spread easily. We are certainly looking at some of those, party environments that we're currently seeing reports of young people gathering in close proximity. These are places where absolutely what can be done should be done, and also there are limits of what can be done for various reasons. There aren't a lot of other high-risk environments that are really coming out in terms of our data right now. We're not seeing significant outbreaks in workplaces that have high vaccination rates. Cases are not spread. Cases are occurring among primarily unvaccinated. They're not spreading far. So that's fairly reassuring. And there's actually a plateau in the data provincially and locally where you're seeing the case counts flatten very much, which again is likely related to high vaccination coverage, as well as some naturally acquired immunity among the unvaccinated as they get infected with COVID. So, we're looking at that. There are additional measures being put in place, especially around vaccine policy. They all will make a difference. And hopefully we can avoid a really significant wave this fall.
Thank you very much. And a final question from Jennifer Beeman for you, Dr. Mackie. How is the health unit's third dose rollout going, especially in long-term care? Do we know how many people have received a third shot?
Yeah, so that is ongoing, Jennifer. We're not reporting back third doses separately at this point, but as that campaign continues, that certainly will be the case. Almost all of the long-term care facilities in our area have been able to come on board with the COVAX vaccine tracking system and are able to vaccinate their own staff, with some logistics support, primarily around supplies from the health unit. So that's a huge shift. Huge thanks to everyone in long-term care who has been working to make sure that they have that capacity in-house.
Thank you very much. The next question comes to us from Kirat Walia at the Western Gazette. Mayor Holder, this is a question for you, and it does relate to something you mentioned in your opening remarks. Kirat is asking, Mayor Holder, will you be attending the walkout on Western Campus tomorrow?
Well, Kirat, thank you for that question. Tomorrow, actually, I'll be away at a family funeral. But frankly, if I could have been there, I absolutely would have. This also gives me a chance to acknowledge and commend the organizers of this event. I gather all student-based and student-prompted, and I think that's so important. And look, I truly hope it will help in changing culture and the healing process. So while I can't attend, I look forward to helping in any way, absolutely, that I could going forward.
Thank you very much, Mayor Holder. Jane Sims has another question for Dr. Mackie. Dr. Mackie, this relates to your opening remarks about full vaccination. Dr. Mackie, how many people in our region would have taken the Sinopharm or Sinovac vaccine?
Yeah, thanks for the question, Jane. I know people pre-submit a lot of questions, so I always appreciate any that do relate to the opening remarks. Our estimates would be that it's in the hundreds. We don't have exact data. Many of those people have come to the health unit or submitted through our online portal their evidence of vaccination so that they can be tracked through the COVAX system. But we don't have an exact number, and that hasn't been mandatory to this point. So there certainly are those that are out there that haven't done it. Normally, you have thousands and thousands of international students traveling to London and Middlesex, primarily London, to attend Fanshawe, Western, and other post-secondary and actually secondary schools in the area. That obviously has been significantly curbed in the face of the pandemic. You really aren't seeing those large numbers. So it isn't the number that we would previously have expected. And again, ample capacity in the mobile and the mass vaccination centers to support those that need that third dose.
Thank you very much. Let's go to our next question. Sophia Rodriguez has the next question from CBC London. And Sophia, I saw your question and I actually went to our dashboard to take a look at the most updated numbers today. Your question says, we've now seen over 20 cases reported at local schools. That number is actually 14. There are 14 cases that are associated with schools, 1 associated with the childcare. And again, those are located on the COVID-19 dashboard at healthunit.com. So if you'll permit, I'll change the number here. We've now seen 14 cases reported at local schools. Have any of the most recent cases been traced back to a single classroom? The lowest vaccination rate is among those 18 to 24. The Health Unit has made an effort to target that demographic with pop-up clinics downtown. What more can you do to get those people to get their shots?
Yeah, thank you for the question, Sophia. So those cases haven't been traced back to the classroom. And, you'll know when that happens because that'll be when we declare an outbreak. At this point, we don't have any outbreaks in schools. So it's transmission within the classroom that we look for around that declaration of an outbreak. And we haven't seen that at this point. But again, it is early to be able to detect that simply because of the time that it takes for symptoms to show up and test results to come back. So yes, so separately, now we're transitioning into the post-secondary sort of age. 18 to 24 vaccination rates is lower. The doses till dark that we're doing on Richmond has been a huge boom to that population. We're seeing a lot of the young folks attend for doses there. We're actually getting a lot of that crowd in the malls as well. The experience at Masonville last 2 weeks, I guess, when we vaccinated about 2,500 people in a 14-day period in Masonville Mall, is that the majority, about 60% of those folks who got vaccinated in the mall were under age 30. So really exactly the demographic that we're talking about here. And I mean, the malls have been tremendous supports. Huge thanks again to Masonville and to White Oaks. And we look forward to continuing that partnership.
Jane Sims is back with another question, Dr. Mackie, and again, this relates to something you brought up in your opening remarks. Jane asked, Dr. Mackie, what is the criteria for a medical exemption from a vaccine in Ontario?
Yeah, there really are not a lot of medical exemptions that are deemed to be required. At this point, the medical exemptions are primarily around allergic reactions. So if somebody has a documented, a physician diagnosed allergy to one of the components of the vaccine, they may be able to actually still get vaccinated under the supervision of an allergist. We do have an allergist at St. Joe's that offers that. However, that would potentially be considered a legitimate medical exemption. The other exemption is around, again, severe physician diagnosed documented reactions to a single dose. If somebody has a very severe reaction to their first dose that potentially could be life-threatening, then that obviously becomes a medical exemption to getting the second dose.
And a related question from Jacqueline LaBelle at Global News Radio, Dr. Mackie. In regards to the religious exemption form you mentioned in your opening remarks, how many people accessed it this month before it was taken down from the Health Unit's website?
Yeah, thanks for the question, Jacqueline. I don't have the count. We don't necessarily track how many folks have clicked on that link. And
just a word to our media members who are joining us on the call. If you do have a question you haven't yet submitted, now would be the time. We're down to the end. So once again, if you do have a question, click on the text bubble with the question mark in it here on Microsoft Teams, and we will get to that question. question, hopefully, before the end of today's briefing. Jennifer Beeman is back with another question from the Free Press, Dr. Mackie, about that plateau. What's happening here? Is it still too early to see any return to school related surges?
Yeah, and appreciate the question. So, Jennifer, the question about why are we plateauing provincially and locally, the most reasonable explanation is around the high vaccination rates. Again, you've got a little bit of naturally acquired immunity in people who are unvaccinated as they acquire COVID. It is a bit early to see significant spread related to return to school. There's also a lot of safety in the school system, particularly around masking and the extension of masking to the younger age groups. That really does help control the spread in indoor environments. But you know, it looks to be primarily related to high and climbing vaccination rates that are really highest in the world at this point.
Thank you very much, Dr. Mackie. And that does bring us to the end of our questions for this afternoon's virtual media briefing. I'd like to thank you very much for joining us. And also thank you, Dr. Mackie, Mayor Holder, for your information, your insights, and your comments, as always. We will be back with our next virtual media briefing on Monday, the 20th of September at 2 p.m. We hope you'll be able to join us then. So between now and next Monday, have a great rest of your Thursday afternoon. Have a wonderful weekend, and so long for now.